Does honey cure sore throat? Today, we're exploring an age-old solution that's been in our kitchens for centuries, honey, and its effectiveness in treating sore throats. Sore throats are a common ailment, affecting millions each year, leading many to seek relief through a variety of remedies. But how does honey, a simple, natural substance, stack up against other treatments? Join us as we uncover the sweet facts behind honey's soothing properties. The historical and medicinal background of honey. Honey isn't just a sweet treat, it's a substance steeped in history and medicinal properties. For thousands of years, cultures around the globe have turned to honey not only for its delightful taste but for its healing capabilities. Let's delve into the past to understand how honey has been used as a medicinal remedy through the ages. From the ancient Egyptians to the Greeks and Romans, honey was a cornerstone in treating a myriad of ailments, thanks to its natural antibacterial properties. What makes honey so special, especially when it comes to soothing sore throats? The answer lies in its unique composition. Honey is rich in enzymes, antioxidants, and compounds that can fight infection and reduce inflammation. Its antibacterial properties are particularly noteworthy. These properties come from hydrogen peroxide, naturally produced by enzyme activity in honey, making it a formidable foe against bacteria. This not only helps in reducing the bacteria that can cause sore throats but also in healing the inflamed tissues. What research says? Studies suggest that honey is generally effective in treating sore throats, wounds, burns, and skin ulcers due to its antibacterial, anti-inflammatory, and wound-healing properties, while one study indicates no effect on nocturnal coughs and sleep quality in young children. A 2012 Cochrane systematic review by Yushan Huang et al. Found that Chinese herbal medicines, including honey, are effective in treating sore throats. A 2021 study titled, Medical Grade Honey Outperforms Conventional Treatments for Healing Cold Sores, a clinical study NAIC, P. Mosialos, D. Vec, B. Novikova, P. Wagner, F. and Kremers, N. concluded that medical grade honey, MGH, effectively treats cold sores by combining increased antiviral and wound healing activities, while alleviating pain and itching compared to conventional treatments. A 2017 study by M. Nanda, S. Mittal and Vipin Gupta found that honey effectively speeds up recovery of sore throat symptoms and provides greater patient satisfaction without causing side effects. A 2019 systematic review by M. Turani found that honey is more effective than no treatment and at least as effective as over-the-counter cough medications in treating acute cough in pediatric patients. Another highly cited study from 1992, honey's antibacterial activity varies in potency, with some studies showing it to be more effective than standard antibiotics for treating various infections. However, a 2022 study by T. Nishimura, H. Muta, Taisuke Hisaka, M. Ueda and Kazu Kishida found that honey has no pharmacological effect on nocturnal coughs and sleep quality in children aged 1–5 years. Analyzing the evidence. The Huang Y, Wu T, Zheng L, Li S. Chinese Medicinal Herbs for Sore Throat. Cochrane Database of Systematic Reviews 2012, Issue 3 study meticulously searches through both international and Chinese databases up to December 2011, focusing on randomized controlled trials, RCTs, to draw its conclusions. Despite the comprehensive search, the limitation to studies published until 2011 might miss newer insights. The selection of RCTs, the gold standard in research, is a strong point. However, the lack of initial criteria regarding the study's quality could bias the results. The review's data analysis, conducted by 3 authors and including attempts to contact original study authors, adds to its reliability. Yet, the predominance of studies of poor to medium quality weakens the ability to make definitive conclusions about the herbal medicine's efficacy. The findings suggest 6 herbal formulations could be more effective than their controls, indicating potential for further research. But, the authors wisely advise caution due to the methodological weaknesses of the included studies, underscoring the need for high-quality clinical trials. Critically, the reliance on mostly lower-quality studies and the absence of a meta-analysis due to the diverse quality of research limit the strength of the conclusions. The review's recommendations for future research include incorporating more recent studies, applying stricter quality criteria, conducting high-quality RCTs with larger sample sizes, and possibly performing a meta-analysis to offer clearer insights into the efficacy of Chinese herbal medicines for sore throat. It highlights a clear path for future research to build a stronger foundation of evidence on the effectiveness of Chinese herbal medicines in treating sore throat. In the medical-grade honey outperforms conventional treatments for healing cold sores, a clinical study, researchers delved into the effectiveness of medical-grade honey, MGH, for treating cold sores, a common issue caused by the herpes simplex virus. Opting for a crossover trial, the study involved 29 participants who regularly experience these outbreaks. This approach is particularly effective as it allows individuals to serve as their own comparison, minimizing the effects of personal differences on the study's outcomes. Participants, many of whom suffer from 4 or more cold sore episodes a year, applied an MGH-based product at the first sign of an outbreak. After their cold sores healed, they provided feedback on healing speed, pain, and itchiness. The results were promising. MGH significantly reduced healing time to 5.8 days, compared to 10 days with traditional treatments. The crossover design is a strong choice for studying recurrent conditions like cold sores, as it allows for direct treatment comparisons within the same person. The overwhelming preference for MGH, along with reports of faster healing and less discomfort, is notable. The study's small size, with just 29 participants, suggests that these encouraging findings need to be confirmed with a larger group. The timing of MGH application varied, which could affect its efficacy. It's unclear if this timing was consistent with that of the conventional treatments used for comparison. The reliance on participant feedback, while valuable, could be influenced by expectations or the novelty of using MGH, pointing to the need for objective measures in future studies. The lack of blinding could introduce bias, especially in subjective assessments like pain and itchiness. The role of honey as adjuvant therapy in patients with sore throat study involves 200 patients with sore throat, divided into 2 groups, a study group and a control group, each consisting of 100 patients. This design allows for a comparative analysis of the effects of honey in addition to standard treatment. Intervention. The study group received 1 tablespoon of honey twice a day alongside anti-inflammatory drugs, antibiotics, and antiseptic gargles. The control group received the same medications without honey. This setup aims to isolate the effect of honey from other treatments. Evaluation criteria. Patients were evaluated after 5, 10, and 15 days based on throat congestion, fever, pain, patient satisfaction, and other criteria. These criteria are relevant to the symptoms of sore throat and can help in assessing the effectiveness of the treatment. Results. The study reports faster relief of signs and symptoms of sore throat in the study group, with greater patient satisfaction compared to the control group. Sample size and selection. The study's sample size of 200 patients is relatively modest, which could affect the generalizability of the findings. Additionally, the selection criteria for patients are not described, which raises questions about the representativeness of the sample. Blinding and randomization. The methodology does not specify whether the study was blinded or if the allocation to study and control groups was randomized. Blinding and randomization are crucial to reduce bias and ensure the reliability of the results. Control group treatment. While the control group received standard treatment without honey, the study does not mention if a placebo was used in place of honey. The use of a placebo could help in minimizing the placebo effect and making the comparison more robust. Evaluation criteria and subjectivity. The criteria for evaluating the effectiveness of the treatment include subjective measures such as patient satisfaction, which can be influenced by various factors beyond the treatment's efficacy. Objective measures and clearer definitions of the evaluation criteria would strengthen the study's conclusions. Conclusion and causality. The study concludes that honey is effective in faster recovery from sore throat symptoms due to its antibacterial and anti-inflammatory properties. However, without a detailed analysis of the mechanisms through which honey acts and controls for other variables, attributing the observed effects solely to honey's properties may be premature. The 2022 Japanese study was a multi-center, randomized, double-blind, placebo-controlled trial, the gold standard in clinical research. It aimed to minimize bias, ensuring results are due to the treatment, not other factors. Kids aged 1-5 with coughs from upper respiratory infections were chosen from 13 clinics across Japan. They were given either real acacia honey or a honey-flavored placebo syrup before bedtime for 2 nights. Design. A top-tier clinical trial design was used to ensure reliable results. Participants focused on a specific age group and condition, making the findings relevant for similar cases. Intervention. The clever use of a honey-flavored placebo ensured the study remained blind, meaning participants didn't know if they were getting the real treatment or not. Duration. The study lasted only 2 nights. Would a longer trial have shown more significant results, especially for ongoing symptoms? Sample size. With 161 kids participating, the study had a moderate size. Could a larger group have provided a clearer picture of honey's effectiveness? Generalizability. Conducted in Japan, can we apply these findings worldwide, considering cultural and environmental differences? Subjectivity. The study relied on caregivers' reports, using a subjective measure that could vary greatly between individuals. While the study was meticulously designed and provides valuable insights, it's crucial to consider its duration, sample size, and the subjective nature of its outcome measures. These factors might influence how we interpret the results and their application in clinical practice. What the studies show. Research on honey's effectiveness in treating sore throats and other ailments presents a mixed bag of results. While some studies highlight its antibacterial and anti-inflammatory properties, others suggest its benefits might not be as potent as we hope. Effectiveness in treating sore throats. A 2017 study pointed out honey's ability to speed up recovery from sore throat symptoms, emphasizing patient satisfaction without notable side effects. Comparison with conventional treatments. A 2021 study found that medical-grade honey outperformed conventional treatments in healing cold sores, hinting at its broader antiviral and wound-healing capabilities. No effect on nocturnal coughs. However, a 2022 study concluded that honey had no significant effect on nocturnal coughs and sleep quality in young children, challenging the notion of honey as a cure-all. The limitations and unanswered questions. Despite promising findings, the current research on honey's medicinal properties faces several limitations. Study duration and sample size. Many studies are short-term with relatively small participant groups, which might not capture the full potential of honey's effects. Generalizability. With research often conducted in specific regions, like Japan, it's uncertain whether the results apply globally, considering varying environmental and dietary factors. Subjectivity and measurement. Reliance on subjective measures, such as patient-reported outcomes, introduces variability that could skew the results. Conclusion and recommendations. As we've journeyed through the sweet and sticky world of honey and its potential medicinal properties, particularly in treating sore throats, it's clear that this natural remedy holds a special place in both historical and contemporary medicine. But, does honey truly cure sore throats? Let's recap the key points and offer some recommendations. Recap. The healing powers of honey. Antibacterial and anti-inflammatory properties. Honey's natural composition, rich in enzymes, antioxidants, and antibacterial agents like hydrogen peroxide, positions it as a potentially effective remedy against sore throat-causing bacteria. Mixed research findings. Studies have shown varying results, from honey speeding up the recovery from sore throat symptoms and outperforming conventional treatments in some cases, to showing no significant effect on nocturnal coughs in young children. Limitations in research. Current studies face limitations, including short durations, small sample sizes, and a reliance on subjective measures, which call for more rigorous future research to fully understand honey's effectiveness. As part of a holistic approach, consider honey as one component of a broader treatment strategy for sore throats, alongside other remedies and practices. Quality matters. Opt for raw, unprocessed honey to maximize the potential health benefits, as processing can diminish its medicinal properties. Age considerations. Remember, honey is not recommended for children under 1 year of age due to the risk of botulism. Consultation and future research directions. Seek professional advice. Always consult with healthcare professionals before introducing honey or any new remedy into your or your child's treatment plan, especially if symptoms persist or are severe. The scientific community's understanding of natural remedies is ever evolving, and staying informed will help you make the best health decisions. Please refer to the note below for citations.